and welcome to the National Runaway Safelines webinar, Here to Listen, Here to Help. I'm Leo Sipchak. I'm the Director of Training, Prevention, and Outreach.
And I'm Sabrina Hampton, the Training Coordinator.
And we are both pleased to have you today to learn a little bit more about the National Runaway Safeline and our services. So let's dive right into it. We just wanted you to see us for a second. We'll go ahead and unwebcam ourselves during the presentation, and then at the end we'll come back on. So our learning objectives for this presentation are for participants to be able to summarize the history and philosophy of the National Runaway Safeline, to utilize NRS's services in your community, especially in a time of crisis. And again, just to put it into context, as of today, the country is definitely experiencing the COVID-19 pandemic, and we certainly are seeing runaway and homeless youth critically being at risk of coming into contact and testing positive for COVID-19. We see that the landscape of services across the country with shelter-in-place orders and different things that are happening to help keep the spread from happening. We certainly know that here at the National Runaway Safeline, this is part of what we're addressing with this population, and we'll kind of tie that in a little bit throughout the presentation today. But again, we really want to call on all of you who are watching this webinar to connect with us and let us know what's happening in your community around COVID-19 and the homeless population, especially youth. And if there are services that are either popping up or shutting down that would be helpful for us as a referral and crisis agency to know, please feel free, or if there's opportunities for us to partner and provide supportive services to your community in that regard as well, please reach out to us. Our contact information will be at the end of the presentation as well. So lastly, we also want to give you just a snapshot of how of different issues that are affecting youth who reach out to us, and kind of a snapshot of who contacts us. So the National Runaway Safeline, we have been lucky to be a crisis provider, support and service provider for over 50 years. We were established in 1971 as in Chicago as Metro Help, and became the federally designated communication system for runaway and homeless youth in 1974 with the passage of the Runaway and Homeless Youth Act. And we're very honored to be the only organization to have this distinction. In January of 2013, we changed our name for the National Runaway Switchboard to the National Runaway Safeline. And I think what that says about us as an organization is that we're trying to continually stay relevant to young people, to be in touch with the issues that are affecting runaway, homeless, and at-risk youth and their families, and to be a good place that young people feel like they can make a connection to. And so when in 2013, we were like, well, a lot of young people really don't know what a switchboard is. So we wanted to stay relevant and accessible, so we changed our name. And I think we continue as an organization to find ways to continue to stay relevant to young people as well. Our mission is to keep America's runaway, homeless, and at-risk youth safe and off the streets. Each year, we make approximately 100,000 connections with youth and families through our hotline, online, and prevention resources. We do know with the COVID-19 outbreak that we suspect we might see more young people and families reaching out to us, and we want to be a good listening ear, a place where folks can come and get help. So definitely we want to serve that role within your community as well. And we also just have a goal in general to continue to work towards ending youth homelessness and to double our capacity to serve more youth in need by 2021. NRS Services, we have a framework that we operate under. So we utilize a harm reduction, trauma-informed approach to providing solution-focused crisis intervention. Um, we employ a positive youth development approach, not only in the way that we provide services, but in the way that we continue to evolve our organization by bringing in youth voice. We offer confidential, crisis-oriented, non-sectarian, non-directive, non-judgmental, and empowering support. Um, and we collaborate with volunteers and community-based service providers. And again, we really want to expand our partnerships as an organization. We know that partnering with community services, with youth-based services, with communities across the country as a national organization is really the key to our success. So please feel free to reach out to us, talk with us about ways that we could collaborate, ways that we could stay up to date on what's happening for runaway and homeless youth in your community. So our philosophy is that we're confidential, non-directive, non-judgmental, non-sectarian, honest, crisis-oriented, and empowering. So what does all that mean? So we are confidential, non-directive, and non-judgmental. Those three pieces are really the backbone to our ability to provide a way to make young people feel comfortable talking to us. A lot of times in the beginning of our crisis intervention, we will work with them and talk with them a little bit about what that means, that we will remain confidential. However, we also know that there may be situations where we have to break confidentiality, for example, around abuse. So we're honest with people and upfront so that we can empower them to make a decision on what things proceed and what options they're given around abuse reporting. We are also non-sectarian, which means that we are non-judgmental, non-directive. If young people are tied to or rely on a specific faith or religion, and they bring that up as a resource, as a support network within the crisis communication, we will support that conversation. We are not a religious organization in of itself. Um, we are definitely crisis oriented, meaning that at the end of each crisis contact, we want a young person to walk away with a plan. We want them to have connections, have supports, have coping mechanisms that they can rely on to help them get through a tough time. So I'm going to go ahead and turn it over to Sabrina, and we're going to just outline some of our services together. Oops, sorry.
So again, I'm Sabrina Hampton, training coordinator here at the National Runaway Safeline. And what I'm going to share with you is just all the ways that you can connect and contact us. So we are 24 hours, and we work with staff and volunteers to provide support to folks who are in crisis. And we do that through a couple of different ways. So the first one is our live chat option. So if you go to 1-800-runaway.org and click on the chat now button, you will be able to have access to support via the live chat option. The next format that we use is our email. So the emails option is available for those, again, who want to reach out to us, but maybe doesn't want to like have a conversation over the phone. We do have some criteria to our email process. It is a limited communication, but we always encourage folks to continue to use the chat or call us if they need additional support. And then we have our forums. Our forums is a front-facing system that we have in place that young people can, or anyone can, ask questions to the community, and we monitor those responses, and we also answer and provide support, and again, encouraging them to reach out to us if they need additional help. We want to make sure that the conversations on the forums are safe and appropriate. So we are again monitoring those and also assisting folks if they need continued services. And then we have our texting option. Our texting option exists as a way to, again, guide anyone who needs support to our 1-800-RUNAWAY or our 1-800 runaway.org platforms in order to get the services and the crisis support that they need. And while we're providing those support, we do that with the services of 6,500 agencies and other service providers. And that is a wide range of support. So it can be anything from helping, looking for shelter and housing, to information on child protection and making an abuse report. We can also assist with counseling, both for family and also for individual, faith-based community organizations and human trafficking programs, legal information and law enforcement support, medical assistance, so maybe a sliding scale clinic or another medical support system, residential treatment, and also substance abuse treatment. And we want to make sure that all of our referrals that we have connections with follow our 3 A's, which is they're affordable, so sliding scale free, appropriate, that they are appropriate to the group, to the situation, or to the person that we're providing that information to, and also accessible. So these are things that they can access on their own. Um, and I know that Lee also wants to share a little bit more about how we want to be mindful of the current crisis with the COVID-19. So Lee?
Sure. So again, just thinking about if folks that are connecting with this webinar, if you're aware of specific resources that either um, are in your community or that your organization provides, feel free to reach out to us, and we'd love to talk with you a little bit more about including and utilizing those resources. So all the resources that we have in our database, um, as Sabrina said, we kind of verify through those three pieces. Um, and we certainly know that with COVID-19, there's going to be more resources that are coming online that we need to be aware of, especially for the homeless population that might be experiencing different things in their communities. So we want to make sure that we have, the most up to date about community health agencies, trying to again connect with like food pantries, a lot of those basic needs, some of which we already have in our database, but I know different communities are really rallying together to provide additional services and supports during this difficult time. So again, please feel free to reach out to us and share with us information about what's happening in your community specifically.
And we also have some services that we at the National Runaway Safeline provide for in our parent and legal guardians and youth that reach out to us. One of them being the message relay service. So our message relay service is a way for a parent and guardian or a youth to reach out and start the process of communicating with each other. And this is usually done in a nonverbal way. So we're able to take a message for either the parent or legal guardian or youth and support them in drafting that message. We do have some guidelines that we need to follow, make sure that it's constructive, make sure that we're not sending any or providing support for anyone that could be harmful. So we want to make sure that we have talk about those guidelines, talk about what's happening in the current situation for them to use this service, and also support them on how they can reach out to their youth to let them know that is a message waiting for them. And then youth, their criteria is a little different, so they can leave a message with us. Again, same talking about the situation, what happened, doing some checks in just to make sure that some safety precautions are in place, and then also helping them draft it and then reaching out and delivering a message to the parent. Um, and our hope is that these with the service that this non-verbal communication leads to a more verbal communication which is our conference call service. Next slide. So our conference call service is an opportunity for us to advocate and mediate on behalf of the youth and also the parent and legal guardian. So we want to make sure that we are supporting the youth first and foremost, but we want to give them a space to talk about the issues that are happening that led to them needing this service. We want to make sure that both parties are being heard, that we're supporting both parties, and also giving them the space to talk and constructively come up with some solutions to to their issues, and also being ready to provide referrals if they need it. And then the next piece of this is we do one section where we are doing mediation and support with our youth and their families, but we also provide conference call service for a young person who needs to call a service provider or an organization. So just like we talked about with those 6,500 resources, it can be really hard for a young person to reach out to a shelter or to a food bank or to get medical support. So we as advocates want to make sure that we're available and that we always offer to assist in making those calls. So again, we provide that support to youth who are needing it by checking in and seeing if they would like for us to support them with this. So do you want us to call out to a shelter, or would you like us to call out to the healthcare clinic to find out more information for you? And that's just another service that we provide here at the National Runaway Safeline.
So in partnership with Greyhound, we offer a home free program, and this is our family reunification program for runaway homeless and trafficked youth. Um, it's a transportation program to help young people um, in crisis. It has to be youth initiated, be able to get back to their home community, their parent or legal guardian, or an alternative living arrangement. So there's a couple pieces that are important to know about our home free program. As I said, it has to be youth initiated. We do try to do a couple things within this program to ensure the youth and families connection and their safety. So we do try to do a conference call as a piece of this program to help the young person have a good plan in place with their supports, whoever that may be, their parent, legal guardian, or a specific staff person, or ALA. So that could be, for example, could also be like a grandparent. Again, so that everyone's on the same page, that they know what's gonna happen. Sometimes, especially depending on the case, we may also issue a guardian ticket, which can be helpful. And then just to make sure that the young person is safe on their journey home. Again, it depends on the specific situation. And then lastly, we also try to make sure that as part of the home free process that we're connecting a young person to local services and supports so that when they get home, they have that in place already. Um, what I will say to you in addition is during the COVID-19 outbreak, we certainly are seeing kind of an influx of young people who are being stranded, for lack of a better word. So let's say their university shut down, and really the biggest barrier for them to not experience a homelessness episode is to just get a ticket home, is the transportation. And so we've been working in partnership with community providers, with Greyhound, and ourselves to really look at what makes sense to help um, for this program. Are there places where we could expand it temporarily or in general, to really meet the need of young people today? So I know at least for the time being, we're certainly exploring that, and looking to find ways to improve the program and ways to help as many young people in crisis as we can. Um, NRS also has online resources. We have lots of great resources. So we have tips and information for different audiences, for youth. And so an example of that might be things to consider before leaving home, tips for parents. So what to do if my young person is saying that they want to leave. For educators and youth serving organizations, we try to share out as much information as we have. We also on our website have interactive data and statistics from our hotline. This can be a helpful resource or tool if you within your community are looking to get a snapshot of this population in your area. Some of that information is broken down by state, so that can be helpful. We also have lots of great blogs and infographics that can be helpful in just kind of sharing awareness and bringing information about this population. On top of that, we have education and prevention materials on our website that are also available to download for free. We have information of reports that NRS have done, links to valuable research around runaway and homeless youth issues, and then we also have the Let's Talk Runaway Prevention curriculum, which is a free 14-module life skill curriculum for um, organizations that serve youth. Again, the idea behind that is really to build resiliency and life skills in young people, so when they hit a time of crisis, they're less likely to leave home and more likely to connect to community resources or a caring adult. And again, I think I said it's free. So it's a great resource that's just available on our website. We also spearhead National Runaway Prevention Month in collaboration with the Family and Youth Service Bureau and many, many of our other national fabulous partners. We'd love to have more partners, local organizations, community organizations, individuals. There are many ways for you to get involved in National Runaway Prevention Month this November. It happens every November. The goal of the campaign is to raise awareness around runaway and homeless youth issues, and to educate people about solutions and the role they can play in runaway prevention and ending homelessness. And I would say this year it's even more important for us to really shine a light on runaway and homeless youth issues, especially as they are experiencing so many more struggles as it relates to the COVID-19 outbreak and are at risk for so many other things. In addition to a lot of the issues that they were already facing, now they have this pandemic that's happening in our communities across the country that also are putting them at risk. So again, please, there's a link there to learn more about this coming year's campaign. We'd love to have people participate. Feel free to reach out if you have questions about that as well. Um, so anatomy of our crisis contact, we really think it's going to be helpful for you to have a sense of kind of what happens when a young person reaches out to us. So that anatomy of a crisis contact will really be helpful in you being able to explain our services to young people and other organizations or other coworkers that you work with about how we can assist in the work that you do and how we can assist with the young people and families that reach out to us. So I'm going to have Sabrina just briefly go through our crisis intervention model and explain how that looks.
Okay, so our crisis intervention model is a 5-step solution focused, trauma informed model. We also use elements of harm reduction in it to be effective in supporting the individuals that reach out to us. So, the first step of the model is establishing rapport. And when we talk about rapport building, we want to check for safety. Um, if we notice any hesitation, we want to let them know what exactly we do here, and how we can support them. And once they feel comfortable, we'll move into exploring facts and feelings. This is where we spend the majority of our time. We are going to talk about the current crisis that they are dealing with, um, who's all involved, exactly what's happening, and just really talk with them and dig deep into what's been happening with this individual that's reached out to us. Um, and once we feel like we've both, helped the person kind of de-escalate, and really flesh out some of the things that have been going on with them, then we're going to move to the focus on the main issue. So this is at this point, we have again gathered enough information. We've talked with the person who's experiencing the crisis. And what we're going to do is summarize what they shared, again, providing supportive statements and validating their experience throughout this entire process. And then we're going to ask the question of how we can help them today. So, and that question can sound like, what would you like to focus on? How can we best help you? Etc. And from there, we're going to think about options with them. So things they want to consider doing. So at this point, we're talking about eliciting options. So we want to check and see what they've tried before, what worked, what hasn't worked, what they're interested in trying, and try to see if we can match those resources that are available in their area to their current need. And then once we've successfully done that, again, also checking to see if they need us to conference call that service with them, then we're going to move to plan of action and closure. And at the plan of action and closure, we are going to talk with them about their plan. So, what are you going to do when you hang up the phone? Who's involved in your plan? Do you have a plan B? We're also going to reaffirm that they can always give us a call back and that they can talk to us 24/7. And again, discuss the multiple ways that they can reach out via chat, um, or phone or email. Um, and from there, we'll check in just again to wish them luck and in our call.
Great, thank you, Sabrina.
Mhm.
I think the last section of this webinar is really an opportunity for you to get a snapshot of some of our frequently asked questions about our hotline. So, who contacts NRS? So just to give you a quick snapshot, we ask some demographic questions of all of our crisis contacts. So we capture some of this information. So you can see here that 69% of our crisis contacts are female, 26% are male. 5% are transgender or non-binary. We also see that in 2019, at least, our crisis contacts um, really ran the spectrum between ages 12 and um, and adults. Certainly, the largest number of our crisis contacts was between the ages of 15 and 17. Um, we do see definitely one of the trends that we're seeing around age um, is that younger people are reaching out to us. And part of what we've noticed about that is that they also haven't left home yet. So we are seeing that this is a great opportunity for us to really do some crisis intervention, make some connections for these young people to resources, supports, help them think through and problem solve and identify some coping mechanisms. So hopefully they will not have that first run episode. Um, what you'll also notice is that we also ask about race and ethnicity, and you'll see that we certainly have a lot of folks identifying different ethnicities. You will see that some young people choose either not to answer that question or we just didn't get an opportunity to ask it before the crisis contact ended. But you will see that um, the the largest percentage in 2019 was white and Caucasian at 37%. And then you'll see Black and African American was at 15%, 11% was Hispanic and Latino. You'll definitely see that there um, is 6% multiracial, 3% Asian, and 1% American Indian or Alaska Native and Native Hawaiian or Pacific Islander. Certainly, we want to continue to find ways to reach out to different communities and to capture some of this data to really reflect who is experiencing crisis and who's reaching out to us. So what are the most common reasons a young person will reach out to us? I'm gonna let Sabrina take that one.
Some of the top reasons or issues that we encounter on the hotline are family dynamics. And again, these all kind of umbrella under some more categorized issues. So, family issues with family rules or um, changes in family dynamics, such as a divorce or parent remarrying. There's also teen parenting or death of a family member, changing schools. So some of those things happen under the family dynamic. Abuse, we again talk about issues or we encounter issues around emotional, physical, sexual abuse, and neglect. Mental health, this includes depression, suicide, self-harm, psychological or behavior issues. And again, this can be a caller's experience personally or an experience of a loved one that's in their life. Um, and then peer issues, this can include isolation, issues with friends. This can include bullying or even issues around their own self-identification.
And then as it relates to COVID-19, we certainly are trying to start to collect information about how that issue is being raised by young people that are reaching out to us. We know that we are definitely seeing that as part of the landscape of issues that young people are raising with us in the last like month or so. So we're looking to capture some of that. So is it health issues? Um, is it lack of resources? We also would not be surprised with different strategies to mitigate the spread such as shelter in place orders, that we're going to see more, and just with the epidemic in general, more mental health issues, more depression, more anxiety, that we might see more issues around isolation. We know that a lot of the young people's normal supports might not be available to them as schools are closing, as they're not able to be with their friends. We also know that this may, being um, inside, and with social distancing, that could affect a lot of different things within the family unit. So we may see an uptick in conversations about domestic violence or abuse as well.
Yes.
And then lastly, what do you think is important for other folks to know about NRS? I think the biggest thing, and I'll let Sabrina answer as well, but I think the biggest thing is we're here. We're here 24/7. We're here to listen. We're here to help. We want to connect and partner with communities to support this population, to support runaway homeless and at-risk youth and their families. Um, we've been, you know, doing this for a long time, so we feel like, we really can be a good support network, not only to youth and families, but to other service providers. Um, if folks are looking to just know about resources in a different community, we're available for that as well. Sabrina?
Yes, exactly what you said. We're here. We are always available. We have multiple platforms in which people can reach out. If someone isn't sure about how to make a connection for a young person, please feel free to give us a call, and we'll help you figure out what works best for that youth. Utilize our website. There is a lot of great information there. And if someone is hesitant or a little nervous around making the contacts, you can definitely share that information from our website. And it takes all of us to make a difference for youth and to support youth.
Thank you. So definitely, if folks have questions, feel free. I'm going to give our contact information. Please reach out to us if you have questions about our resources, about our services. If you want to just update us on what's happening in your community, um, please feel free to reach out to either one of us, and we'll follow up with you. Again, thank you so much for attending this webinar, and we look forward to collaborating with you in the future.
Thank you.
Thank you.